One of the things that's been suggested to us in the course of this investigation into the impact on young carers of the draft Care and Support Bill published by the Department of Health and currently out till on consultation till October the 19th has been that good practice is already being developed in a number of schools, such as having a nominated lead teacher that young carers can talk to and who can be responsible for providing information and raising awareness about their needs. The carers' strategy emphasises that a young carer's education, training or employment opportunities should not be adversely affected as a result of their caring role, and that services should provide information about the availability of support to encourage carers to come forward to access help. The Department for Education and the Department of Health, in conjunction with the National Young Carers Coalition, have produced an e-learning module for school staff. This aims to increase awareness in schools of young carers' issues. It is available on the Children's Society website. And that is the end of the statement from the Department for Education. Dare I say it? Compare and contrast. I think, John Bangs, you'd like to come in there. Senior Manager, Care Commissioning, Surrey County Council. John?
I think all of that is fine, but the problem, in a way, is what it doesn't quite cover, which is the fact that the National Carers Strategy actually has as one of the 5 underlying principles supporting families so that young carers don't have unreasonable levels of caring responsibilities. And the question is, how do we ensure that that principle is adhered to, which is the policy of the last government and this government? How is it adhered to within the adults and the children's assessment processes? And I mean, it's excellent that work is being done to encourage schools to identify and support young carers, but that doesn't answer the question how the assessment process is to be delivered.
And we obviously leave our listeners to make what they will of those two statements. There's a reference to the National Young Carers Coalition. We have at Carers World Radio been trying to discover a little bit more about the coalition. I have to say, not with the same intensity. We've been pursuing interviews with ministers. John, are you able to shed any light? We're having a little bit of trouble pinning down exactly what this coalition is.
The Young Carers Coalition, it's a loose alliance of organisations that work to support young carers. The leading members of it, I would say, are the Carers Trust, which listeners may know is an amalgam of the Princess Royal Trust for Carers and Crossroads Care, and also the Children's Society, and there are a number of others involved in its work, and they network to improve support for carers. I do know that they're currently conducting a survey of local young carers projects about some of the issues that are being discussed, and will very shortly have some further evidence to send to government, but that isn't to hand as yet, but will be shortly, I believe.
Yes, I daren't mention the Carers Coalition any further because I found the first reference to them with the Department for Work and Pensions, which would introduce a third ministry, and I don't think we could all cope.
Oh, I certainly couldn't.
Probably an adult carers coalition they're talking about. This is specifically around young carers.
This mentioned National Young Carers Coalition. In
Did
the
it
same
really?
breath.
Oh,
but anyway,
gosh.
we won't worry about 2 ministries is enough for the moment.
Yes, that's another special down the line. And I should also say that I do think that obviously John has responded to the statements from the Department for Education and the Department of Health, and just I'd like to just add to that. Yes, I think it is somewhat troubling what was not put in those statements, but more than that, I am somewhat perturbed and actually I have to say rather annoyed. I'm going to be really honest here and just say I'm really annoyed that I think the question that they were asked in terms of making a statement really doesn't strike at the heart of anything. It's a bland, innocuous statement that I find annoying. And I think it's a cop-out, and I just have to say that from the point of view that I just think it's completely mundane, and that's my view of that.
Well, our viewers and listeners no doubt will have their own thoughts on that. If you do, by all means, if you're listening to the programme now or if you're watching us on the podcast, do write to us at production@carersworldradio.com, production@carersworldradio.com. We would love to hear from you. This is an issue which we are going to continue to look at very actively indeed. Now, one of the references, one of the people that we've heard referred to in the course of the programme, is Barbara Keeley MP, who brought forward a private members' bill called the Social Care, Local Sufficiency and Identification of Carers Bill. And I spoke to Barbara a little earlier on. Joining us now on Carers World Radio is Barbara Keeley, the Member of Parliament for Worsley and Eccles South, who brought forward a private members' bill in September. Welcome to the programme, Barbara.
Good afternoon, hi.
In thinking about and working on your draft bill, you clearly must have identified a need that your proposals would fill. What were they?
Well, one of the key issues that we were tackling, there were a couple of issues. One is about social care, but the other is about the need to identify carers and to make sure that they get information, advice and help. And that is a need that I've become aware of over the years. And we really need some legislation to make that a duty onto the people who are best placed to identify them. So it's different in different cases depending on the age of the carer. But there really is a need to identify carers so that they are not struggling without help when there is advice, help and support that they could benefit from.
And given that background and that need, and particularly thinking about young carers, how do you see the current draft care and support bill?
Well, I think that young carers are very much left out of many of the measures. I did some work and familiarised myself with the work of carers and young carers before I came into Parliament, and it's really quite shocking how much professionals, be they social work professionals or health professionals, ignore the situation of young carers within families. It may be that a GP is dealing with a member of the family because they've got an illness or a disability or an addiction, and yet, really, if they thought it through, they'd understand that young carer will be suffering some impacts from, whatever is the situation in the family, an illness or whatever, and yet they don't do anything about it. So there very much needs to be a recognition of the role of young carers and the fact that caring has a significant impact on the lives of young carers in many cases. Perhaps an even greater impact than on adult carers. Absolutely, yes. I mean, there's a range of, clearly there are similarities, but I think there are additional factors. I mean, the type of things that can be happening, certainly with young carers, if they have a heavy caring workload, they may be falling behind in their schoolwork, they may be being bullied, they're definitely missing out on leisure and the ability to be children or young people, whatever stage of their lives they're at, because they're doing tasks which are, in some cases, adult tasks. So they're dealing with this difficult situation in the family, but it probably, and in a lot of cases, has an impact on the rest of their lives. And it very much needs teachers and health professionals to recognise that and to help them deal with it. Because if a teacher doesn't understand that a young person, a young carer, is falling behind in work or is tired or not turning up on time because of their caring responsibilities, then, they're just not being fair to that person. So there's understanding their situation so they understand perhaps why they're late with schoolwork or didn't get something done or failed an exam or were just not in school on one particular day, but also supporting them through what can be a very difficult time for them. Making sure they get advice and help.
When you're referring to a duty, the buck has got to stop somewhere. The Department of Health, who have brought forward this draft care and support bill, tell us that when it comes to young carers, it's basically the Department for Education. We've also spoken to Stephen Dorrell, the chair of the Select Committee on Health, and he's basically saying someone has got to take responsibility here. Now, given your empathy with young carers, your understanding of the subject, who do you think that should be?
Well, I think it is very